And that can be really hard because, as I said, alexithymia gets in the way, depression gets in the way, BPD or other personality disorder traits and symptoms get in the way, and we got to push it down. We got to keep fighting on it. And this is something you can absolutely do. You have to have the hope and faith in yourself that you are going to continue to go forward, and you absolutely can. Have you ever felt like your emotions are all jumbled up? It's just a huge jumbled mess, but you can't find the right words to explain how you feel? Well, this could actually be a condition or a symptom that is called alexithymia. Now, this is a term that describes problems with feeling emotions. Fun fact, in Greek, it loosely translates to no words for emotion, and it's estimated that 1 in 10 people have alexithymia, but it is much more common in those with depression and in individuals along the autistic spectrum. So what we want to do is we're going to break it down. We're going to break down alexithymia, how it might manifest in those with BPD. And as we know, and if you've watched my other videos, you know that borderline personality disorder, about 85% of individuals diagnosed with BPD also experience major depressive disorder. So this is highly related to both of those groups. So let's get into it. Now, the science behind BPD is getting clearer. So there's more research. We're discovering more. And people with BPD often struggle identifying their own emotions, making it hard to sort of navigate and get through a lot of social situations. And this may be you. You may be in those situations where you want to get it out, you want to explain yourself, but you don't know how because all those words are just jumbled in your brain. Well, this difficulty, along with feelings of depression, seems to be really strong and highly related to those with BPD traits. Now, basically, the less that you understand your own feelings, the more likely it is that you experience or have a higher probability of experiencing signs or symptoms of BPD. Now, just because I'm talking about higher probability doesn't equal causation. Alexithymia, even if you have that, even if you have difficulty describing emotions, it doesn't equal BPD. What it does increase the probability that you may be dealing with some traits of BPD. We're going to break that down. Now, I also want to talk about just what the research shows, because it's really important to know what's out there, because that gives us a really clear and objective perspective. Objective perspective, like that kind of rhymes. But this new research suggests that emotional awareness is a key central component in BPD. And with my clients, I work on enhancing their insight to recognize their emotions as best they can. And identifying your emotions is a skill, which we'll talk about in a moment, that you can build. It's like ice skating. The more you do it, the better you get at it. Now, when we understand emotions better, we might be better able to develop new ways of managing those BPD symptoms and recognize that there's a hindrance in identifying emotions, managing emotions, which brings in alexithymia. And when we look at alexithymia and BPD, this helps explain why it's hard to understand your emotions, for you to explain your emotions to others. And this is particularly true when your core content gets activated and you start feeling overwhelmed. Now, if you've seen my other videos, if you've read my books and stuff, you know that I talk about core content, those underlying issues. Could be the classic core content for those with BPD is rejection sensitivity, fear of abandonment, and emptiness. Now, you may have those three issues, and when they get activated, you become sort of more excited, right? More emotional. And that makes it really, really hard to communicate yourself effectively, particularly how you're feeling. And if you don't know what your core content is, that makes it exceptionally difficult to really get a handle on that activation and that sense of overwhelm when you feel like someone's abandoned you. You feel like you're going to be rejected. And then you start to feel this sense of emptiness inside. And the best example, as much as I hate text messaging, it's absolutely convenient. Like, I totally get it. But I absolutely hate it because I think that we have a built-in expectation that when we text, that person is going to write us back immediately. And this is something that a lot of my clients contend with. And it's that implicit understanding or belief that I'm going to text and you're going to text me back immediately. When they don't, that time to sending the text and until you get a response, even if you get a response, what happens is that gives what's called BPD and family in the head. This is that stuff in our brain, right, that tells us, oh, you know, they're abandoning you. They want nothing to do with you. Or rejection. They've kicked you out. They don't even want to know you. Or emptiness. You know that horrible feeling inside? That's because they don't care enough about you to text you back. And this is all self-manipulation. And it's important to be aware of that. At the end of this video, I'm going to put a link where you can learn more about that. More about not only that family in the head, but that self-manipulation. Really important to check that out. Now, let's talk about how to get the words and insights in order to better manage that pain that you feel inside, that confusion, that misunderstanding of self. Let's get to it. Now, if you work with a mental health provider, often what we do is, just as I mentioned a moment ago, is that we build insight to help you understand your feelings, but also increase your awareness of what's going on around you. If you're not in tune with what's going on around you, it's hard to recognize how you feel about it. And if that's confusing to you, makes total sense. Makes total sense to me. Because what happens is with BPD, there's a constant sense of worry, anxiety, push, and almost panic. So it's hard to focus on what's going on around you, and you often feel like you're in a fog. Like it's this constant fog, and when the fog is so thick, you can't really get a handle on what's going on. You feel lost within it. And what we want to do is we want to guide your attention away from habitual, rigid beliefs, and we want to refocus towards your body sensations. Now, when I talk about those beliefs, those are those BPD, family in the head stuff that we just talked about, that come up about your worth, your value, your brokenness, all of those components. We want to lessen that and increase your bodily sensations, how you're reacting to what is going on around you. And as a therapist, a lot of times when I'm working with a client, we talk about that. How was that for you to do A, B, and C? What was it like for you to experience A, B, and C? What's it like for you to imagine doing A, B, and C? And the A, B, and C in that last example is doing something adaptive. Maybe meeting a healthy other, reaching out to someone else. Maybe when you text someone and they don't respond back right away, challenging that thought, all of that family in the head and BPD, and saying, you know, people are busy outside of their concern or worry for me. Maybe it has nothing to do with me. So allowing yourself more time, allowing yourself to just relax and let it be, and then refocusing on what's going on around you. Now, there's a lot of techniques that you can do that can help you at that time, and to also have that greater sensation and awareness of how you feel. Now, we do something called mindfulness. Now, if you're familiar with DBT, and DBT really centers in and focuses on this skill of mindfulness. Now, mindfulness isn't meditation. People are often confused by that. Mindfulness is actually bringing yourself to the present. And when you bring yourself to the present, you observe and accept the sensations that you're feeling without judgment. And you promote a more balanced emotional experience. So instead of getting lost in your family in the head, instead of getting lost in your BPD lens, which is this distortion that often comes with an inability to explain how you feel, an inability to understand what is really going on around you, and it is getting caught up in that distortion that's really hard for you to explain. So mindfulness can help level that playing field for you. Mindfulness, for example, right? So I got my little, what is it? There's that AirPod thing, you know, the little case. Oh my God, right? So I got my little AirPod case here. And this you can use for mindfulness if you've got AirPods or earbuds or whatever they're called, you know, call them whatever you want. Okay, so what you can do is it's a real smooth case. And what that can do is bring me to the center. And this is something a lot of us carry around. Now, what I often do is I like to do this. right? And that can be annoying to some people, so I'll do it real quiet. You know what I mean? But it helps to bring my attention to it. It helps me refocus. And just feeling it is a mindfulness practice. It's refocusing your attention on the present, on the smoothness of the case. If I flip it over, it's got that little charging port, right? And I can feel that. And I'm like, oh, yeah. So it brings my attention to the present. You can do it with anything. If you have glasses, if you have a little watch, right? Things like that. Sometimes, I'll feel it. I can feel the little holes right there, that roughness. And that can be a mindfulness activity. Brings you to the present because attention is key. And what we want to do is you want to focus your attention toward that sensory input. And rather than just these beliefs or these statements or whatever else that negative component of self is driving you towards. And we want you to recognize how you feel, whether it's your AirPod case, whether it's the roughness of your watch band, whatever it may be. Bringing your attention to that, recognizing how it feels, and then just kind of taking a deep breath. It can just take a second. It is a skill that you have to keep practicing. But what happens is it lessens the adverse influence of your BPD and family in the head. And that's what we want to do. Because in working with people as long as I have, that I have realized that when people can get their BPD and family in the head out of the way, right, kind of clear the path, they want to do well for themselves. They want to use more adaptive strategies. The problem is, in the development of a personality disorder or the utilization or the presence of traits, of personality disorder traits, which many, many of us have, and in developing these personality traits or symptoms, what happens is that we can cut down on the confusion, cut down on getting lost by using our attention, focusing on those sensory moments and getting out of our head and getting out of that whirlwind, that whirlpool that spins us around, and we're spinning around and spinning around until we're finally pulled under. It's time to stop being pulled under. And when we shift our attention, we can recalibrate our emotional experiences. And this can help us develop a more adaptive understanding of our feelings. Now, I've got an emotions exercise that is on my website. I'll show you a little picture of it right here. And you can go to my website. I'll put a little tag here on the bottom, right? drdfox.com/worksheets. And it's in there. Check it out, because it's going to show you a list of all these different faces and all these different emotions. And I want you to learn that. But it's more than just learning the emotions. It's also recognizing your sensory perceptions, right? When you feel something, when you're in a situation, and that sense of overwhelm, so you can catch it. Because that sense of overwhelm is often a prelude to those sensations, those things that you experience in your life. Well, let's catch them. Let's empower you to better manage them so you control them. And your BPD and family in the head don't. And that's exactly what we want to do. Now, if you don't have anyone that can help you or work with you to do this, I really want to encourage you to find a good mental health provider that can provide a safe and supportive environment. This can be really strange, and it can be uncomfortable for a lot of people to talk about, because they're like, well, I don't want to talk about that. I don't really read emotions well. People might think I'm weird. And they're not. They're not. If they genuinely care about you doing well for yourself and using adaptive strategies instead of falling to maladaptive strategies that can be chaotic relationships, self-harm, violence towards others, whatever it may be. Those are maladaptive. Moving to an adaptive way of living and functioning and responding and recognizing emotions, communicating in a more efficient and effective emotional way helps you turn down and manage the adverse influence of alexithymia. And that's exactly what we're doing. But you got to have that safe and supportive environment. It doesn't necessarily have to be a physical one. Now, it can be somewhere online. You have somewhere online where you can go and you can talk about dealing with these things in an effective way. Not where people are going to rag on you and place where, well, you don't know how somebody's going to respond. That could be BPD and family in the head, but you deserve to be understood and respected if this is something you're working on, because it is hard. And genuine emotional engagement and a reflective kind of dialogue is crucial in helping you understand not only the challenge, but also challenging and dealing with those rigid beliefs that you have, but also understanding and conveying where you are emotionally. And that can be really hard because, as I said, alexithymia gets in the way, depression gets in the way, BPD or other personality disorder traits and symptoms get in the way, and we got to push it down. We got to keep fighting on it. And this is something you can absolutely do. You have to have the hope and faith in yourself that you are going to continue to go forward, and you absolutely can. And I think a mental health provider can help you. A close friend that you know is objective, who you can trust, can also help as well. That's also really, really important as well. And I want to encourage you to check out and learn about your own experience or thoughts. Certainly leave those in the comment section, but I also want you to check out emotional reasoning and BPD. And I'll put the link right here at the end as well. I mentioned it earlier, because that can really help you have a greater understanding of what is going on with you. Building that emotional awareness, enhancing your emotional reasoning, turns down BPD, family in the head, and it helps to attenuate all those problems that come with alexithymia. That difficulty of recognizing, dealing with, and managing your emotions. So leave those comments, check out this other video, and I will see you next time. Thanks a lot. Bye-bye.